We have with us dietitian Vidya Rajesh, who would talk on facts and myths on PCOS and also case scenarios. So to begin, I'll give a brief introduction on Mrs. Vidya Rajesh. She completed her MSc in Dietetics and Applied Nutrition in Welcome Group Graduate School of Hotel Administration, Mahe, and she's currently pursuing her PhD in Infant Nutrition from Triple MC, Mahe. She began her career as a dietitian at Adarsha Hospital, Udupi. Later, she worked as a dietitian in Kasturba Hospital for 2 years. She is currently working as a clinical dietitian at TMFI Rotary Hospital, Karkala, for the past 4 years. She has also a research paper published on effects of breakfast skipping in school children in Index Journal, and also published newspaper article in Udayavani. And she has conducted various nutrition awareness camps. I welcome you, ma'am.
Thank you. Firstly, I'd like to thank Meenakshi ma'am for giving me this opportunity, and also Dr. Ajit, who has given me this opportunity to present a talk. Am I audible?
Yes, yes, you are.
Okay. So I'll be dealing with the polycystic ovarian syndrome myths and facts, and also the case scenarios. So the outline of my session is, first I'll be talking about some myths and facts of PCOS. Then I'll be presenting 3 case scenarios. The first
Yes.
first
And
will
please go on, ma'am. Please go on. No problem. There were some. Yeah.
okay. So first will be the background of the patient, that is the case profile. Then is the anthropometry, biochemical and the clinical parameters of the patient. Then nutrition evaluation, which will incorporate a 24-hour recall, drawbacks in the diet and the planned achievable goals. The nutrition intervention, which will include the principle of diet, and based on that we will be calculating the estimated needs or the requirements of nutrients. Then to put it into practice, a modified diet and a counseling note and the outcomes that were achieved. So to begin with myths and facts, there are several myths and facts that surround PCOS, but unfortunately there are also quite a bit of myths that surround PCOS. So we need to understand this, because that will create more awareness about this condition. So first, the first myth is, have you done something, or have you induced something or to cause PCOS? So it is not true. The exact cause is not known. That how did you suffer, or how is a patient suffering from PCOS, as Chaitra ma'am has already spoken about it. So, but what happens is, genetics do have a role to play, and androgens, that is which are responsible for the development of male traits, they are in more in number than normally which are present, and therefore it prevents ovulation, and there is a different difficulty for the menstrual cycle to occur. So therefore that there is PCOS. The second myth is, do all women with PCOS have ovarian cyst? This is not true. Though there will be tiny follicles present, but they are different from the ovarian cyst, or they are not cancerous in nature, and they do not cause any pain. The third one is, PCOS is a rare condition. Many people think that it is something that not which is not very common. But the truth is that it is one of the most common hormonal endocrine disorder among women of reproductive age. And in India, the range is from 3 to 22%, as Meenakshi is told. It the figure may sound less, but actually the incidence is higher, and also it depends on the criteria of diagnosis. So and it is also one of the leading cause of infertility in women, so it is not a rare phenomenon. And the fourth myth, is it not possible to conceive if a person is suffering from PCOS? This is not true for everyone, though. There are a number of treatments available which can stimulate ovulation, and it is always better to give your body a chance, so that like for the treatment to induce changes. The fifth myth is PCOS affects only overweight women. That is not true. And though PCOS occurs mainly, like commonly it is found in underweight or in overweight or obese women, but there are and obesity only worsens the symptoms of PCOS. But PCOS is also seen in lean, which like many people are asking, questioning about that. It is also found in lean, that is a person having normal BMI or underweight. So lean PCOS is also found, and the relationship is mainly regarding the weight and the insulin resistance, and that is why weight comes into picture. And the last myth is, if you're not trying to conceive, is it okay? Like, is PCOS not that important? But it is not true. You have to take it seriously. Like, if you are suffering from PCOS, it cannot be left untreated, because it will develop into many deleterious health effects, like central obesity, cardiovascular diseases, hypertension, diabetes, which is more common, and it may develop to a metabolic syndrome. So you should never leave it untreated, and you should always seek guidance for the same. So starting the basis of all the cases that have been treated, this is the Meenakshi ma'am has already spoken, and she has extensively covered the topic. Just a briefing of what are the principles of, like, on which basis have I planned my diets. So if we look at the data, this is an old article, but all the guidelines or all the points that have been mentioned are, I think it's still relevant practically. So if you see, there is no specific diet, like there is no PCOD diet for this condition. It is said that it is better if you emphasize on individual preferences, like you have to tailor a person's diet according to the cultural needs, the socioeconomic status, and his likings, aversions, okay, his body pattern. Okay, so there is no specific diet, or there is no specific guideline that this has to be the like the ratio or the percentages of nutrients. Secondly, overall calorie restriction. So the basis is you have to restrict on the calorie, mostly in obese cases. In lean patients, what we do is we try to maintain the weight.
Yeah,
So
please, you go ahead. Someone was speaking. I just pushed off.
okay, so it is through many studies, it has been seen that at least if you get a modest weight reduction, that is about 5 to 10% of weight reduction is also beneficial. And though it will, what happens is it will improve the abdominal obesity, improve the insulin sensitivity and the lean body mass of the person. Okay, and it is a known fact that, like, it has been seen, I've seen it in practice also, that women who are suffering from PCOS, it is very difficult for them, it is harder for them to lose weight than the normal woman. Okay, so what happens here is, even if there is no visible changes in the weight, or what there will be a there will not be any overall weight reduction, but there will be a change in the fat percentage, and the lean body mass will increase. Okay, so that will also help in increasing the insulin sensitivity. So low GI food, as ma'am has already thoroughly explained the concept. Okay, so low GI foods is what we go for, because otherwise if you choose high or glycemic index or low, if the diet has more of that, it will deliver the carbohydrate rapidly for ingestion, and therefore there will be an increase in the glucose level. Moderate carbohydrate is what we recommend, because as ma'am has told, low carbohydrate will be effective only for a particular or a short term. It is not sustainable. The person will not adhere to it for a long term, so that is not practically advisable. Because so moderate carbohydrate is something we opt for, and moderate to high protein depending on the BMI of the person. If you reduce carbohydrate, if it is an adolescent who requires more amount of energy, so we can give it through protein. It what protein does, it increases satiety and also the postprandial thermogenesis. Okay, and coming to the fats, it has to be unsaturated fatty acid, mainly omega-3. Chromium and vitamin D also play a role, as chromium is a cofactor in insulin synthesis. So even that improves the insulin sensitivity. Okay, so the first case is of a classic example of PCOS, female, but she also is a diabetic. Okay, so she has accelerated weight gain, and the family history, her mother is a known case of diabetes and obesity. She is suffering from obesity. Okay, so there have been a lot of data that a person suffering as Chaitra ma'am has already sorry as ma'am has already explained that uh, the person suffering from PCOS is more prone to for the risk of for diabetes, and it becomes a vicious circle. Okay, one suffering from obesity will also be prone to PCOS. So there have been several mechanisms that have been proposed for insulin resistance. Mostly it is peripheral target tissue resistance, reduced hepatic clearance, and that is why there is more of insulin resistance in a PCOS patient, and they have more of a risk of diabetes. So the anthropometric measurements of that patient height is 163 centimeters, weight is 70. So the BMI comes up to 31.6, and the ideal body weight is 63 kgs. So the it falls in obesity grade 2. The waist hip ratio is also 1, which is which exceeds the normal level. Okay, so in this study, what this study is done in okay, so here they have also compared the uh, uh, BMI of the patients who are uh, like depending on their this BMI status. They have graded them, and what they have found is mostly patients who are in obese grade 2 or obese grade 2 patients are there. Women fall more in the range of obese grade 2. So, and also the waist hip ratio was also found to be more than 1. Okay. So the biochemical parameters, as we see that there is not a much of increase in all the parameters, but the glucose levels were high. Okay, clinical parameters, there were hirsutism and pigmentation was seen, and this is like there are these symptoms have been recorded in a lot of data that irregular periods, scanty periods, acne, all of them are related to PCOS, and it is widely seen in Asian women. Okay, so looking at the 24-hour recall, the patient morning consumed bread slices and omelette with a cup of tea. Lunch, there was no mid-morning meal. There was directly lunch with the brown bread and one sabzi or palya. Okay, then evening was tea or digestive biscuits, and late evening it was chocolate bar, like one whole bar of chocolate, and dinner would be white rice or with 1 cup and fish curry. Okay, if you look at the other details, okay, the socioeconomic status, it will come up to middle class. Occupation, she's a teacher. Education level, she's a graduate. Mixed type of diet was being followed. Type of cooking oil is sunflower oil. Water intake was 1.5 liters, which is very less. Food, there were no food allergies, and smoking or alcohol, none of them. And the physical activity status was sedentary. So this is one of the studies which is highly relatable. It is done it is a hospital based study, which is done at Dharwad cities of Karnataka. So here also what you see, all the nutrient intake, energy, protein, fat, all of the nutrients, may it be adolescent or the adult, the nutrient levels are very less or lesser than the RDA value. Okay, so nutrient evaluation, the drawbacks in the diet is there is hardly any fiber in the diet, and empty or energy dense food, that is the chocolate bar, or those are consumed, the portion size is more, macro and micronutrient deficient, and there is irregular, or like she had told that she is doing some physical activity, but it is almost to a sedentary level of activity. So if you see, compare with the ideal body weight, 7 kgs of weight loss is recommended, but initially we'll be starting with 2 kgs per month, because that is something practical, and it will not be something like the patient will not feel that he can't do that. So we'll start with a small value, reduce abdominal obesity because the waist hip ratio is very high, increase the fiber in the diet, and motivate the person for regular physical activity by telling him the importance of exercise and physical activity in his it will affect a diet also. Okay, so what nutrition intervention was done? The principle of diet: low GI foods were used, moderate carbohydrate, moderate protein, high fiber, good amounts of unsaturated fatty acid, and low saturated fats. So on calculating, what we use is the adult sedentary woman would require 25 calories per kg of IBW. It will come up to 1000. While planning a diet, like we'll take it around like an approximate value. If it is 1000, if it has come 1575, then we'll take it as 1500, or if it is close to 2000, it will be 2000. While like these cases have been dealt on an OPD basis, so you have to plan the diet. Okay. So the protein will be 1 gram per kg IBW, of that will be around 60 to 65, and the fluid requirement will be 2.5 to 3 liters, and all the nutrients have to be taken care. Okay. So the modified diet, initially I suggested her to start the day with a glass of warm water with roasted fenugreek and curry leaves powder, because fenugreek, as we know, it has been proved that it will help in improving the insulin sensitivity, and therefore because the patient is diabetic also, that will help. whatever is the rice or the whatever will be roti or the upma, dosa, idli, whatever the person is taking, you just have to modify it. If you tell them to take an altogether a different food or a recipe, it will be very difficult for them. So whatever rotis, you can add soya to it, wheat to it, ragi to it, so that there is cereal pulse supplementation, and also the protein content is improved. We should never it is better if we do not give a complete carbohydrate source, but also complement it with the protein source. So cereal pulse combination is advised. Then because she's working, she can carry a fruit like an orange, sweet lime. Okay, so she can have that for morning snack. Then lunch, it can either be rotis, or if there is no time, like at just in one pot meal, everything, a pulse, cereal and vegetables can be added to all of that. Buttermilk and curd will also improve the gut microbiome. Legumes, as Meenakshi ma'am has already told, that legumes, a plant-based diet, is it improves the insulin sensitivity, and therefore it is better we incorporate those. Evening, that is the time when there is like you get the most number of hunger pangs, and that is where you have to control. Even if we see the 24-hour recall, that is the time where the person is having a lot of the calorie intake, or the trans fatty acid, sugar is more at that time, because we go for some food that is it is very tasty and readily available. So as you can see, this boiled corns or puffed rice, with vegetables, okay, or some nuts, or a glass of milk with turmeric powder. Curcumin has been also been proven to be very helpful in PCOS. So all of these are something that is there is no cooking involved. Okay, so that could be an ideal snack for the evening. And dinner can be a parboiled rice with fish or chicken in the boiled or steamed form, or one portion of the vegetable proteins, that is dal, sambar, rasam, okay, or 1 cup of curd. With the meal has to start with salad. Okay, it can be as simple as an onion, or a tomato, cucumber, any of that can be cut and it can be had. And before eating, a glass of water should be taken. Throughout the day you have to consume water, but if you begin, or like if you just about 5 minutes ago, if you drink a glass of water, your hunger will come down. And most of the times we're actually thirsty, but we think it is hunger, and we go for food. So first you should drink water and then have your meal. So the outcomes, there was a very slow, she lost 1.5 kgs per month, but sugar levels were normal, and consequently, like, she kept on losing weight, and her menstrual cycle was regularized, and after some time we got know that she eventually conceived normally. Okay, so the second case is of lean PCOS. Okay, it is an adolescent girl, a high school student. She has inflamed acne and irregular menstrual cycle, and she was diagnosed with PCOD. So what we have to remember is lean PCOS in 5% of all the lean women have PCOS, and it is a factor which is less researched, because there is only there is the population of lean PCOS is very less, so there is very less data available on that. And around 50 to 75% of lean PCOS women are insulin resistant. Okay, and reactive hypoglycemia is something encountered in this case. What happens is there is a drop in sugar about 1.5 hours or from 5 hours of eating. So there is increased need of there is it increases hunger, and there is excess energy consumed, which will be stored as fat, and that will increase the insulin resistance. Okay, and also high AG levels are found, that is advanced glycation end products. They are highly reactive molecules. They are actually the way from the metabolic processes, they are the waste products. And it has been found that in lean PCOS patients, the levels, circulating AG levels are very high, and foods which are susceptible to very high temperature, and also increase animal products do have them, so that has to be avoided, like red meat. And low calorie intake, even if a woman with a low lean PCOS patient, if they tend to have lower calorie intake, and they always find it because, like, if you compare it with a normal woman, their calorie intake will be lower, but still there will be changes in the weight, so it is harder for them to maintain their weight. Okay, so the anthropometric measurements, height was 155 centimeters, weight was of 45 kgs. There is a mistake here, that is 45 kgs. So the BMI, if you plot a graph, it will come as she is an adolescent, so it will come in the 50th centile, and therefore, referring to data similar to the case, you can term it as a normal or a lean patient, PCOS patient. Okay, so the biochemical parameters, the thyroid, FSH, LH, testosterone were checked, and the prolactin levels were found to be higher. There was inflamed acne and irregular menstrual cycle. So the 24-hour recall, as ma'am had already mentioned, the importance of breakfast. Okay, so here what we see is breakfast is like the person who had uh, that's that girl always used to skip breakfast, and that is something. Okay, so the breakfast is very important, and that is something um, uh, we have to pay, skipping breakfast is one of the major flaws in the diet. Then directly she used to have lunch, that is parbol rice, which with a cup of sambar. Evening time again here would be some fast food, like egg puff, one or two in number, and sometimes she would just have one plate of pani puri. And she also used to skip her dinner. There was a lot of micronutrient deficiencies. Also, her nails were very soft. Okay, so that is one of the, like you can know that how deficient she was in micronutrients. Okay, so she was from the upper middle class, and she also tried a few of the fat diets, and that is why that pattern can be seen. So she was a student. A mixed type of coconut oil was used for cooking. Then water intake was 1 liter per day, which is very less. Okay, sedentary level, as she was a student, she did, and she also didn't engage in any other activity like sports. Okay, so the nutrition evaluation, the drawbacks in the diet, the main thing is skipping breakfast. Skipping breakfast will also have an impact on her performance in school, and also the food metabolism also will be affected. Then macro and micronutrient deficiency, then high intake of sugar and trans fats, and low hydration. Okay, so the goals, if she loses weight, she has to gain, but here she has to maintain her weight as it is in the normal range, increase the muscle mass, so that there is improved insulin sensitivity and correct the micronutrient deficiencies. Micronutrient importance are chromium, omega-3 fatty acid, like ma'am has already explained their importance in case of PCOS, but also calcium and iron as she's in adolescent, he also needs those nutrients. Okay. So the principle is low GI foods with moderate to low carbohydrate, moderate to high protein, high fiber, good amounts of unsaturated fatty acid, and very low saturated acid, fatty, low saturated fats. Then calcium, iron, chromium, omega-3 fatty acid have to be taken into consideration. So as she's an adolescent girl, the nutrient requirements would be according to the NIN, the dietary guidelines for Indians, it would be 2,500 kilocalories for an adolescent girl. But because we are like we are estimating for a weight loss of 2 kg per month, it will be 2,000 kilocalories. Also, the protein requirement would be 50 grams. Calcium will be 800 mg per day. So there has to be good sources of calcium and iron. So the modified diet, she was a little inclined towards fat diet. So I tried to incorporate a little, like not the traditional foods as it is done with other patients, depending on what they're comfortable with. So a bit of other foods like chia seeds, so that she is interested in the diet. Okay, so otherwise the adherence is less. Okay. Warm water with chia seeds or overnight soak almonds is a good source of unsaturated fatty acid and as well as protein. So morning can be multigrain the normal wheat flour which is used for making chapati, ragi can be added to it, soya can be added to it. So the nutrient value increases. Rava idli or any other ragi dosa with vegetable, upma or the normal upma or oats with vegetables, you can take that. And mint or coriander leaves or even peanut butter, homemade peanut butter can be used if the to just break the monotony. Then mid morning can be 1 cup, 1 or half teaspoon of roasted flax seeds, or a corn, the boiled corn can be taken, or one fruit can be taken. The local, the better, as ma'am has mentioned. Okay, so the lunch would be a whole wheat chapati or two chapati or 1 cup of rice can be taken with one palya or sabzi. Mainly, it is better you go for a legume or a soya bean, peas. Those sabji or palya, those are better, or 1 cup of curd. Then chicken or fish pieces can be taken, cucumber slices and a cup of curd, and milk with cardamom spices have also been it has been studied that they also have a positive impact on the PCOS symptom. So that can be taken, and like that is the time when she used to crave for something like fast food. So at home only scrambled egg, cheese frankie, okay, or lentil soup can be taken. And because she used to like soup, a homemade soup can be taken. And or vegetable tikki, shallow fried cutlets of vegetable, that is very easy and like quick to prepare. Whole grain crackers are also okay. Then dinner has to be early with the chapati or ragi dosa and simple vegetable pieces like tomato slices and sprouted green curry. That is just an option. Okay, so the weight was maintained and her menstrual cycle were regularized and the acne also decreased. Okay. The third case is that of morbid obesity. So here it was a 33-year female The weight was 101 kgs with height of 160 centimeters. She was diagnosed with PCOS, and she was a little uh, depressed about that. She had a negative body image, and the family history, uh, her she had a family history of obesity and diabetes. Okay, so here if you see the height and weight, um the body mass index will come up to 40.5. And I uh, referring to this data, I have uh, when you classify, it will come up to morbid obesity. Even the waist hip ratio was high. Okay, so here she has to lose a lot of weight, but like she can start over it with a lifestyle change. Okay, so when you see about PCOS and obesity, there are multiple reasons for obesity in South Asian women. In this data, they have explained that lifestyle practices in South Asian women remain poor, and views and beliefs regarding diet and obesity are often incorrect. Okay, and mostly it is like after they deliver, after their delivery, like after they give birth to a child, there is most of the women will fall in the obese category. They are not able to maintain their weight or lose weight. Other factors that predispose Indian women to obesity include sedentary behavior, imbalanced diet, sequential and additive postpartum weight gain, and a decrease in physical activity during this period, and cultural and security concerns related to outdoor physical exercise that is seen widely, like in rural areas also. They are afraid, like just to stroll outside is also a concern. Okay, so those are some of the factors why obesity is like seen in PCOS. Like these are some of the social factors. So the biochemical parameters, thyroid, FSH, LH, were evaluated, and the prolactin levels were found to be high. So for morbid obesity, mainly it is recommended, like first, pediatric surgery is something that comes into our mind, but it should be um, clinically severe obesity, that is BMI about 35 to 37, and with other risk factors, and if other methods have or treatments have failed. Okay, so here in this study also you can see that diet, exercise and behavioral therapy is also something recommended even if the person is morbidly obese. Okay. So here, diet, as you can see, an individualized hypocaloric diet, reduced carbohydrate, saturated fat, and the advice of correct oils and cooking method. That is very important, because cooking oil is something they'll be using every day, and even the methods, okay, deep frying or washing of cut vegetables, even all these small things has to be taken into consideration. High protein diet or meal replacement if the person is willing for it. Okay. So here in 24-hour recall, we can see that she used to have dosa 3 to 4 in number with the chicken gravy or the whatever is the leftover of the previous day. Mainly, they have an inclination to a non-vegetarian food, and mainly it is in a curry form, a gravy form, which includes a lot of oil and fat. Okay, mid morning always would be, as they thought it is healthy to have fruit juices. Okay, so processed fruit juices. Lunch would consist of parboiled rice or fish curry. Evening would be some of the one kind of fried food, and dinner would be parboiled rice with fish curry. Okay, so the socioeconomic status, they are from middle class. Okay, the socioeconomic status is occupation, she is a housewife. Education level, it was pre-university. It is a mixed type of diet. Palm oil, which is a rich source of saturated fats. Water intake was less, 1 to 2 liters per day. Food allergies, she didn't have any food allergies. Smoking, alcohol was also not there, and physical activity was sedentary. So the nutrition evaluation, the drawbacks in the diet were large portion sizes of, as you can see, everything, the portion sizes are very, are large. Then excessive intake of processed food, sugars, trans fat, the diet lacked fiber, it was micronutrient deficient, and fluid intake was less, and no exercise. Even though she was so morbidly obese, she had a negative self image, and she lacked motivation. So the goals, like, though she has to lose a lot of weight, it has to be gradual. Okay, how because if you tell them to lose a lot of weight at once, it is like it is not sustainable. They will not even try attempting that because they found it overwhelming. So much of so it has to be gradual. Then to reduce abdominal obesity, decrease portion sizes, and even by data you'll know that if you tell them to lose a lot of weight, it is something they will not find it very like pleasing, or so it has to be gradual. And to decrease the portion sizes, restrict on processed food, and just just simple walk, about 20 minutes is something, like I tell them, a simple walk or a Surya Namaskar at home, yoga. Okay, so the nutrient intervention, the principle of the modified diet was moderate carbohydrate, moderate protein, low saturated fat with high, like the unsaturated fatty acid was high. So adult sedentary woman, she will require 25 kilocalories per kg body weight, that is 1500 kilocalories. Protein is 1 gram per kg body weight, and fluid requirement will be high, so that hunger comes down. Okay, so the modified diet is early morning, it is better to start with a glass of water and one fruit. So there is uh, high intake of fiber. Okay, and thus it will like reduce the intake of other foods gradually. uh, Rotis, idli, so whatever is the like the normal diet, that has to be modified with the pulse has to be included, uh, vegetable also. And if they are more inclined toward non-vegetarian food items, they can have egg, they can have one boiled egg in the morning. Green tea can also be used. Tea, coffee, milk without sugar, just to decrease the calorie. Then flaxseed powder has been, as ma'am has already told, it has been proven beneficial, and that can be added to buttermilk. Okay, or sprout salad, or fruit salad, or fruits should not be taken more in quantity. So vegetable salad with sprouts or curd would be a good option. For lunch, it would be rotis and 1 cup of dal or soya peas. Soya had the isoflavonoids, and also the phytoestrogen has been studied to have positive effects on PCOD patients. So curd, buttermilk, salad, 1 glass of milk in the evening, and one handful of nuts, puffed rice for evening. Dinner would be rice, fish, and lots of vegetable. It could be salad, palya, okay, in any form the person likes. Okay, so it was the initial part was very difficult for overall weight reduction to see. It took about 1 to 2 months, but gradually the person lost, like, till the last follow up, he had lost 10 kgs, and like I just motivated him to uh, like keep on following that, and continue the weight loss process. Then the menstrual cycle were improved. There was thinning of hair seen in this case, even that was improved, because the micronutrient deficiencies were corrected, and because she lost weight, she also started feeling good about herself. Like there was a positive change seen. Okay, so counseling note would be the same for all of the PCOS patient. As ma'am has already told, if it is grains, that should serve as the foundation of your diet. Whole grain foods, ragi, wheat dosa, bread, brown rice, beans, all of them in pulses can be used, as they are loaded with vitamins, minerals, fiber, and healthy carbohydrates. Also, varieties of dals can be used. Vegetables, as they are high in vitamin and mineral content. Also, some vegetables and fruits have large water content, varying amounts of dietary fibers. So they can be used in a steamed or cooked manner without fat or oil, or very light seasoning or tempering. And you should always opt for dark green and deep yellow vegetables for rich dose of antioxidants and phytochemicals. Beans, green peas, curry leaves, drumstick leaves can be used. Okay, and the root vegetables should be used in moderation. Fruit, whole fruit preferred than juices. And milk and dairy can also, in a skimmed form, like the layer of cream has to be removed and it can be consumed. Um, so milk and good options. Then eggs, even fish is a good option. It is rich in iodine, so not in a fried form, but shallow frying, and no deep frying or addition of breadcrumb sauces or oily gravies. But plain ground masalas can be used in cooking. Uh, Oils, a mixture of two oils is recommended. It could vegetable oil, sunflower oil, safflower oil can be used. Coconut oil in limited amounts or lesser amounts can be used. And fried foods, ghee, dalda, butter, all of them should be used, should be avoided. So foods that has to be avoided are simple sugars, and cake. All the bakery stuff should be avoided. Fat, cereals, pulses, all of them can be eaten in moderation. And foods permitted are green leaf vegetable, fruits, except banana, lemon, clear soups, onion, mint, spices. All of them can be. There is like, you need not keep an account of the amount. So suggested, as ma'am has already spoken on this, regular sleep pattern is very important for, or you have to regularize, you have to sleep early. It does play a role in your menstrual cycle. Exercise or gardening, a home kitchen, you will always get organic food at home if you start that. Then Yoga, Surya Namaskar has been found to be beneficial, and breathing exercises. Meditation, it will reduce your stress levels, and breathing exercises are very, I've found to be beneficial. Thank you.
Session. It was really good, and the case studies you have described in a good way, so our students can understand, and they can learn a lot from that. So,
Thank
if
you.
someone has the
I would,
question,
yeah, I'd just like to thank Meenakshi ma'am for giving me this opportunity. Also, you, Dr. Ajit, Climate Research Solutions, for giving me this opportunity.